rectal exam and a PSA. If you have a family history, I usually start a baseline at 40, and African Americans, like I said, 40. If you have a family history and you're African American, I've had a few of my guys, like this family I was sharing, I'd recommend it at 35. They needed a baseline. I'm 45. I've been getting my father was diagnosed when he was 60. I get a rectal exam and a PSA every year and started that about 8 years ago. And thankfully, I've not had to have a biopsy yet and don't look forward to that. But if it has to be done, it has to be done. This is one of my favorite slides a friend of mine sent me, that you wouldn't be here if it wasn't for early detection. There's no question. Early detection is the key. It's like I tell people, it's a lot easier to head off. You know, my grandmother used to say an ounce of prevention is worth a pound of cure. I get guys in my office every year, and it really is, it just breaks your heart sometimes to sit down and talk with a guy that I just sat down with about 2 weeks ago. He came in to see me with a PSA of 25, and he had been seeing somebody, and his primary care doc had been trying for years to get him to come in and see me. And finally, his wife she put the screws to him and broke down. And I biopsied his prostate, and it's full of cancer. And I really can't cure this guy at this point. And it's really heartbreaking because, I mean, that's a guy that 3 or 4 or 5 years ago, had he come in, I probably could have made a difference in him. But, you know, you can only deal with what you get. It is sad because so many people are afraid. You know, I never it's a part of my job. I always ask the Lord, never let me get used to telling people they got cancer. Because if you do, you've lost your compassion. But what I will tell you is that if you tell a guy they've got cancer, and you deal with it, it's a lot easier to deal with a problem when it's small and not big than once the horse is already out of the barn, because by that point, you're doing supportive care and palliative care. You're not doing curative care. Enlarged prostate. This is something you're starting to see more of men become aware of, a lot of direct-to-consumer marketing for drugs for enlarged prostate. I want to talk about that a little bit and sort of where we go with that. An enlarged prostate, it's also called BPH. It's a very normal process that begins in all men at about the age of 30. I get guys in my office all the time. They're 55, 65, 75, 85. Doc, I'm really worried I've got an enlarged prostate. And I look them straight in the eye and I said, if you're 50 and you're in my office and your prostate's not enlarged, something's wrong. I tell them, getting an enlarged prostate is like getting gray hair and wrinkles. It's going to happen to all of us, okay, to some degrees. Now, the size of the prostate doesn't always reflect a problem. I have guys that have huge prostates. And the biggest problem that we see from prostate is not prostate cancer and enlargement. It's problems urinating. And we have to define this. Every man gets enlargement of the prostate as we get older. Okay? Some men develop cancer, some men don't. Men with enlarged prostates, some have problems urinating and some don't. And it's totally unpredictable. I have guys in my office that are 55, the prostate's not that big, but they're getting up 4 or 5 times at night, the stream's weak, can't pee, and it's driving them crazy. I get guys that are 90 and they say, Doc, I get up once, but that's only because I got to let the cat out and I go back to bed, you know. And so it's very variable. The size of the prostate is not always indicative of the treatment that needs to be undergone with this. But it can lead, the biggest thing that you get with the enlargement of the prostate is urinary problems. And this sort of gives you an example. It's sort of a split view. And what it basically shows you is this. This is the bladder here, and the urine goes right through the middle of the prostate. This is what we get with enlarged prostate. It basically blocks you off. I'm very simple. I explain it to this to people. Think of your prostate as the sort of the tunnel that goes through. When you have a rock slide, you can't pee. We need to get you peeing better, okay? It is amazing to me how many men I see with problems like this, because prostatism, enlarged prostate, voiding difficulties, you'll hear us call them LUTs, lower urinary tract symptoms, bladder outlet obstructive symptoms. It's a very insidious process. It starts very slow. You don't just wake up one night, oh my gosh, I'm having problems. If you talk to guys, the best people to talk to are their wives. Because I'll say, guys, how many times do you get up at night? Once or twice? She'll go, you know, how's his stream? Pretty good. She's going, horrible stream. Our wives are honest with you. You know, they'll tell you, he gets up 5 times at night. He stands at the bathroom for 20 minutes. You know, I've been to ball games. I've been out to restaurants, and there's some guy standing there leaning. Just standing there and said, you okay? I'm fine, Doc. I'm fine. You know, and so, although after the senator last week, I'm a little nervous about talking to people in the restaurant. But it's one of those things that so many men, it's an insidious, slow process. You don't just wake up one morning and have problems. It's slow. And most guys, when you talk to them, will say, you know, Doc, if I'm really honest with you, this has been going on for a long time, and it's just progressively getting worse. And it's a slow process, but it is very treatable. What are the common symptoms of an enlarged prostate? Frequent and urgent need to urinate. Guys say, Doc, when I got to go, I got to go. When I go to church, when I go to the mall, I know where every bathroom's at. I plan my trips around that. they'll tell you, when I start, it's kind of, I call it stutter avoiding. They go, and they stop, and they go, and they stop, and they go, and they stop. It's like, it's funny because, I have an 8-year-old son, and when he goes in pees, it sounds like someone's got a water hose in there. Shh. And in some of us, we're a little slower as we get over, and that's very normal. Guys will say, I just don't feel like emptying my bladder well. I go and turn around, and I go to the bathroom, and I walk right back in. And the most common thing you see is the getting up at night. The guys go from once to twice to 3 to 4 times. Things that you need to understand about the getting up at night. I tell people, the getting up at night is the thing that guys notice the most, but it's the thing that least returns to normal. We've looked at studies looking at both men and women, and I get guys in my office all the time. They say, Doc, the stream's good, I empty good. I get up twice at night. Does that bother you? No. Studies have shown in both men and women over the age of 60, the average is getting up twice at night. Probably has to do with the fact that as we change, the nerves to our bladder change, and we tend to go more frequently, and that's just the nature of the disease, of the nature of the aging process. As one of my patients says, Doc, getting old is not for wimps. So that's one of the things I tell you. But that is the last thing to get better. But I can get guys, the guy that's getting up 6 or 7 times a night, we will get him better. But for those of you with voiding symptoms, this will be the symptom this will be the last symptom to improve. Okay, and I tell guys, you're never going to be 20 again, but we can make you better. What are the treatment options? They range from all kinds of options. Watchful waiting, not doing anything. I have a significant number of my men that I talk to them, and I tell them, the worse your symptoms are, the better you're going to do with therapy. The milder your symptoms are, you're not going to get a whole lot. The guy that comes to see me that gets up twice a night, his stream's a little slow, but he empties okay. He is not going to get a lot of improvement out of any kind of medical therapy I do for him. Medication, the big drugs you see now, they're advertising Flomax, Avodart, Proscar, Uroxetrol. They categorize into 2 categories of drugs. Let me just talk about that because somebody may be on one of those drugs. The first type of drug are what we call alpha blockers. Okay, drugs. The 2 common drugs that you see are Flomax, and the other one is Uroxetrol. There's also some generics of what we used to call these are the newer generations. The earlier generations was a drug called Cardura or doxazosin, and a drug called Hytrin. It was also called Terazosin. And what they actually do is relax the prostate. They do nothing. All 4 of these categories do nothing to shrink the prostate. They actually help the prostate relax so that you can empty better. Okay. The second category of drugs are called 5-alpha reductase inhibitors. Basically, these are the drugs like Proscar and Avodart. They actually shrink the size of the prostate. And people say, well, which one do you decide to use? It depends on the type of prostate. It depends on the voiding symptoms. And so that's kind of where the art of medicine goes. Sort of a thumbnail thing. The Flomax, the alfuzosin, the other drug was called Uroxetrol. They're sort of a quicker to get things going. The 5-alpha reductase are more of a long-term drug. I have a significant number of my guys that have been long-term Flomax or long-term Uroxetrol and doing great. If I got them peeing better and they're happy, don't rock the boat. Tend to be a lot more sexual side effects from the Avodart and the Proscar. The Avodart and Proscar guys tend to get a little breast tenderness or enlargement, and they can have some problems with erectile dysfunction. So that's one of the things. Cool thermal therapy has become one of the newer things now. It's actually microwave therapy. And no, Joe Guy says, does it ding when it's done? No, it doesn't. It's actually a catheter that we actually can do this procedure in the office. I have 2 of my partners who have a very keen interest in doing this. Basically, you put a catheter in the bladder. It stays in for about 35 minutes and actually sends microwaves into the prostate, help the prostate shrink and open up and pee better. I tell the men that have this, your urination will get a little worse before it gets better. But in about 80% of men who have this, okay, they actually are able to get off their medications. And then the last one is surgery, the quote, ream job, the roto-rooter, the core job, whatever you want to call it. This technique has made some significant improvements in the last several years. Used to, it was a big, bloody, nasty operation. With the advent of most of us are now using a laser for this, it has significantly decreased our blood loss. And most of my patients who have this have their surgery, go home the same day, catheter in overnight, and they're pretty much, back to speed. I will tell you, this used to be the TURP, which stands for transurethral resection of the prostate, was the #1 procedure performed on men. Okay. The number of this procedure has dropped off dramatically because of medical therapy. I tell guys, I'm not a rocket scientist, but if I've got the option of having an operation or taking a pill, I tell you which one I'm going to do. I'm going to take a pill. But there are still some men that do need surgical intervention to help their problem. Erectile dysfunction. Now, this is a very sensitive issue for most men. I have no problems with saying penis or erectile dysfunction. It's a problem. It's a natural God-given talent that God gave us. A friend of mine, his name is Steve Auerbach, who's in California.